Good morning. Welcome, ladies and gentlemen. Thank you for joining us for today's webinar. My name is Samyant Ravi. I am the assistant editor at Clean Middle East magazine and your host this morning. Today, the topic of our webinar is one that has taken the world by storm. Since its first case was reported in December 2019, the coronavirus has claimed approximately 64,000 lives and infected more than 1 million people across the globe. The numbers are only expected to rise in the coming weeks as the virus spreads to more and more countries. In this webinar, which is being organized in association with Riza Hygiene, leading regional provider of sustainable hygiene products and solutions, we'll be discussing about how to combat coronavirus through a food safety perspective. Just a few details before we get started. If you have any questions during the presentation, please type them into the question box on your panel and I'll bring them up during the webinar. We'll also have a quick Q&A session with our expert in the end. Now, without further ado, we introduce to you our speaker today, Ms. Judy Sebastian. Judy is the General Manager at Apex Food Consultants UAE and founder of Apex Global Consultants USA. Equipped with over 10 years of experience, she has a dual specialization in food safety management systems and organizational culture development. She is a speaker, writer, and consultant, and her contributions to the food safety community include her column in Wiley Publications USA and Global Food Safety Resource Canada. She consults businesses on food safety management systems implementation with a human-centric approach. In addition to this, Judy represented the UAE at Expo Milano 2015 to share cross-cultural experiences and innovations in the world of dining and hospitality. With valuable insights from Judy, you can learn much about food safety in terms of COVID-19. Thank you for joining us today, Judy. Judy, can you hear me?
Yes, hello.
Yes, hello. Thank you for joining us today.
Thanks, Sonia. I appreciate the warm welcome.
My first question, Judy, is that how dangerous is COVID-19 in restaurants, food processing centers, and supermarkets? Does this virus affect our food?
Before I continue, I just wanted to do a quick check-in to make sure my audio is okay.
Yes, we can hear you well.
Perfect. There hasn't been enough scientific backing to prove that COVID-19 transmits through food directly. But when we think about, restaurants, cafes, supermarket, the one element that's hard to ignore is the human element. And so it's already been proven that it's contact to contact, or human to human contact rather, that's not only causing the widespread of the virus itself, but it's also making it even more difficult to contain. So from a food industry perspective, when it comes to food itself, the virus poses no threat. But when it comes to humans handling food, this is where it gets a little bit more complex. And we're talking about person-to-person contact.
Points through which infection can spread in these facilities.
Pardon me?
What are the major touch points through which infection can spread in each of these facilities? Restaurants, food processing centers, and supermarkets.
I'll begin with supermarkets since that's what's on a lot of our minds these days. If you think about, end-to-end processes with supermarkets, you begin with receiving the goods until it's cashed, paid for at the cashier, and then checked out, bagged and checked out. So there are numerous checkpoints, right, from receiving until monitoring of, vital parameters like the integrity of packaging, the temperature, and from storage to display until sale, and then bagging out. There are multiple points of contact, and it doesn't just limit itself to the employees, but also the customers. So you have folks who are high risk. You have folks who may not be high risk, but considering the complex web of different age groups, different risk factors when it comes to supermarkets, this is where it can get a little bit more complicated, and there are many more touch points. One thing that I do appreciate about certain grocery stores and supermarkets that have adapted to controlling these touch points is an example that comes to mind is having specific hours for senior customers, and then having other hours set aside for our regular customers, like folks that are not as much in high risk. The other thing that comes to mind is brands are promoting contactless services. And in essence, we're thinking about, how do we limit the exchange of currency, the exchange of credit cards if possible. So if there are apps through which you can pay directly through your phone, and that way you can avoid another layer of human contact, by all means, I would highly recommend going that route. So that's the supermarket side. And I apologize for not going too much into detail because I understand we have a time frame to keep in mind. When it comes to restaurants and cafes, now this is where the dynamic shifts a little more, because we're talking about not just packaged food, but we're also talking about food that's prepared, food that's served, and then also packed in go-to packaging. There are even more touch points if you think about it from the restaurant perspective, because you have processes like deboxing, you have processes like preparing and cooking and cooling. So even though there may be good food safety management systems in place, it doesn't mean that a business is immune to cross-infections. It doesn't mean that the business is immune to contamination. So it's mindful practices that will help us be aware of the touch points at restaurants. A very common one that comes to mind, and this is where it's so important to be mindful, is how often do you change your gloves? As much as we can talk about good hand hygiene and washing your hands every 20 minutes, if you have the same pair of gloves on all day, you've probably escalated the problem and not controlled it. So there are those hidden touch points as well, one that's not obvious at first, but you have to be in the operation long enough to understand that there are other risks associated with not following good hygiene practices.
Do you think, as far as supermarkets is concerned, we've seen specifically in Panda supermarkets that they thermally scan everybody who enters their facility. So do you think that also helps towards food hygiene, food safety rather?
One thing that we need to understand that there is a clear distinction between health and safety and food safety. So food safety is what we can do to ensure that, the food that we prepare and serve remains safe. There is a small crossover because we're talking about employee health, and employee health also plays a significant role when it comes to food safety. Now, although the virus by itself does not transmit through food, sick employees can transmit the disease just through physical contact. And another thing that we need to be mindful of when it comes to thermal scans is only going to give you the surface temperature. A, it's only going to give you surface temperature. And B, if you think about it realistically, if an individual, let's say, decided to take 2 Panadols or, painkillers or analgesics, that does not get picked up by the thermal scan. So thermal scans, to an extent, can tell you what the surface temperature is, but thermal scans cannot verify that the individual is free or does have coronavirus.
Point well taken. What kind of training do you think should be given to personnel handling food in these difficult times?
I would begin with just creating an awareness as to what the virus is all about. What is COVID? Why is it called COVID? And you know, where did it originate? How did it come to impact us at this extent? I think what's missing with most training programs around this is the haste to, you know, put out all the information on personal hygiene without a lot of background as to why this is important to each and every one of us, not just within the food safety industry, but also with every other industry. We're looking at supply chain, we're looking at we're looking at the education sector, we're looking at petroleum and gas, airlines, like we're all connected. So helping employees understand where they stand in that wide web of industries crossing over and being affected is a good starting point. And from there, what can they do to safeguard themselves, their families, and their customers? I think it's important to include the element of how do you safeguard yourselves and your cared one, you know, the ones you care for, because that's what makes the experience a little bit more human, and it helps them relate. So designing a training around personal hygiene is great, but if it's not relatable, if it's not customized to what they do day in and day out, then that training would just be a checkbox training, not so much an effective training.
Do you think that because the time is very less, Judy, to train these people right now, what should be the approach of the management?
I would say take it day by day, evaluate where we are at as a business, and evaluate what's to come with the resources at hand. So although we do not have a lot of time to, effectively eliminate COVID-19, we do have time to learn from others, to learn from research that's around us. And as a science professional, my request to other professionals out there, especially food safety officers, is simplify the science. You know, when you use terminologies like cross-infection or infection control, try to use language that's simple and that's easy to stick onto, because at the end of the day, you want to make sure that you're on the same page with your learner. So although we don't have all the resources that we need to fully understand how quickly this virus evolves, what we can do is share relatable stories with the time that we do have and help our employees understand in a language that they understand best.
I also wanted to ask you about food processing centers. What measures should they take to ensure food safety during this time?
So for clarity purposes, Samia, are you talking about manufacturing?
Yes, manufacturing, particularly.
Okay. Yeah, so from a manufacturing standpoint, there is certain similarities around catering and service, except here there may or may not be as many human touch points as there would be with a restaurant or a cafe. Depending on the process involved, there may be more, you're looking at storage, you're looking at distribution and reprocessing. So whenever there is a human element involved, reevaluate how the operation is run, and also take into account how supply chain is going to impact you. So for manufacturing professionals that are on this call, I think it would be wise to pay close attention to what's happening out there in the world in terms of where your suppliers are from, what's happening in their countries of origin in terms of where your produce and other products are coming in from. And do you have a backup supplier? Now, if there is a high demand for a product that you specialize in and you have a key supplier that you choose to do business with, in the event the supplier can no longer be your go-to source, do you have a backup? And how have you validated that backup? Do they meet the standards that you need to ensure that your systems and operations are safe as well?
Okay. What cleaning and hygiene practices must be carried out to prevent contamination and clean facilities that have been potentially contaminated?
Right. So there are two parts to this, and I appreciate you drawing attention to what to do before and after. So proactive measures would be intensifying cleaning and disinfection more than you would, especially at high risk areas where you have ready to eat food, you have chilled food, you have pre-packaged food, and also take a closer look at your non-food areas where your employees gather. For example, the staff cafeteria, or if there's a lounge. It's other areas that also need to be considered, and especially restrooms and changing rooms as well. There have been several federal announcements in terms of what are the approved chemicals to go with. And something else to be aware of is it's not just the composition of the cleaning chemical, but also the contact time. So please do not compromise on contact time, because cleaning and disinfection would not be effective if it's not for that required contact time. Proactive measures such as this, coupled with good hand hygiene, can keep this under control. Now, in the event that you do have an employee who has reported positive for COVID-19, and the approach would be very different in this case. This is where it's important to know exactly where your employee also resides, what kind of accommodation are they put up in, and if there are ways to reach out to that specific community to let them know that, hey, one of our employees tested positive, and also check in with your other employees. Follow the standard quarantine procedures depending on where you're based. Your federal government will issue standard procedures in terms of how do you self-quarantine and what do you need to do next. As far as cleaning and disinfection goes, I would recommend to not attempt to take this on by yourself, because there are specialized professionals out there that deal with this kind of stuff, that know what to do when it comes to cleaning an area where you have someone who's tested positive for a certain disease or illness. And do not attempt to take this on by yourself, because again, this is still a virus that's under study, that's under the microscope, and there's a lot we don't know about it. So please get in touch with your federal authorities and the designated companies that specialize in sterilization programs.
All right. What kind of chemical disinfectants are safe to use in food processing, restaurants, and supermarkets?
Without naming brands, from the studies that are out there, they are seeing success rates with alcohol-based solvents and hydrogen peroxide-based solvents, and other chemicals that contain products like, compounds like, sodium hypochlorite, quaternary ammonium. So the studies and the science are out there, and your suppliers will be able to provide you with that, the data that backs up their claims. But what I also want to emphasize on is it's not just the type of chemical, but it's also the contact time. So the nature of the chemistry of the cleaning agent and contact time is what's going to make your disinfection and sanitization process successful.
What is the ideal contact time?
Whatever your manufacturer recommends. If they provide it in minutes, follow it in minutes. Do not cut it down to seconds. And also look into the dilution factor. Now, some of them recommend to not dilute it. Some of them recommend to dilute it. Whatever the manufacturer recommends and under the conditions that they prescribe.
Adding spraying the food with disinfectants constantly, does it alter the composition of food? Is it safe for consumption then?
Are you talking about spraying it directly into ready-to-eat food?
Yes, like fruits, like open fruits, which we have in the markets. If we spray disinfectants onto them, does it affect their quality?
Oh, you mean fruits? Okay, I'm sorry, I misheard. Yes, so when it comes to fruits and vegetables, please go by what the federal authorities have stated, because there are mixed responses out there, and there are also mixed studies out there. Now, scientifically, it is not safe to be consuming food products that have been directly sprayed on, although there are steps involved, like washing your fruits and vegetables, that's approved. And the reason why washing is safer is because there is a step that dilutes and eliminates the chemicals on the surface. So if you have, hard-skinned and soft-skinned vegetables, there is a step involved when you're actually washing them that at least minimizes the concentration of chemicals on the surface of fruits and vegetables. But spraying them directly onto fruits and vegetables at an open, like a farmer's market, is not advisable, because you don't know how long the chemical has been sitting on, that particular fruit or vegetable, and it can have effects on the overall quality of the produce. So directly spraying it on is not advisable, and I would recommend following the manufacturing instruction.
When it comes to takeout or delivery services, what are your food safety recommendations?
If the business has the option to do online payments, I would recommend that, because if you think about it, when delivery folks drop off food let's say they have another delivery queued up, it's going to be very difficult for them to change their gloves if they do have gloves on, and to wash their hands after a cash transaction. So as much as possible, go for online payments if you can, and if the business supports it. So that way you don't have a lot of human-to-human contact at the point of delivery. Now, from the point of packaging it and taking it to its desired location, my recommendation is to not, accumulate deliveries. Do not try to attempt to deliver multiple stops in one trip, because you want to eliminate as much as possible human exposure. So if one delivery per trip, although it's a bit more tedious, if this can be practiced, it limits that exposure. And think about how often your drivers are, being sent on trips. If they're sent on trips all day, and if one driver has visited 20 households, you have already invited a risk right there, because you don't know if members of those households may be either carrying the infection or not showing symptoms, asymptomatic, and still carrying the infection. And that driver could be putting you and your team at risk. So take a look at how many deliveries are being done per day. And I know it's a tough balance given the economic climate right now, but some calls will have to be made and some difficult decisions will have to be made. So finding that fine balance is really important.
What are your tips for chefs and managers who manage actually the kitchen hygiene and safety?
So to food safety leaders out there, from front of house and back of house, if you're managing a team, I would really encourage you to do a check-in every day. Check in with your team, see how they're doing. It's not an easy task to keep morale up in an economic climate such as this, and to some extent political as well. Start with that, and then look into the resources that you have. A very common misstep that happens when it comes to managing something like this is not keeping inventory of available resources, and being able to plan ahead, predicting your needs ahead. So an example that comes to mind is, do your employees have enough gloves? I mean, we can offer all the training that we have on good personal hygiene and best practices when it comes to controlling cross-infection and controlling the virus itself. But if the employees themselves don't have that resources available to them, then the training has been undermined, and there was no beneficial outcome from the training. So keep in mind, if your employees have the resources unavailable to them, what can you do to make sure that they have access to that? Do you need to plan ahead for gloves? Do you need to plan ahead for disinfectants? If you foresee, a possible change in suppliers, what do your employees need to know, and what processes are changing? Another thing that I would advise food safety leaders, specifically in the service industry, is to keep a close eye on your manpower. Now, typically when it's high volume based, you would have the resources at front of house and back of house. However, given the scientific data behind the impact of social distancing and how it's showing success stories, I would advise you to follow the same. If you do not need 10 employees and you only need 5, it may be a bit of a stretch, but you are still doing your part to make sure that everyone's safety is accounted for. So follow the recommended guidelines, but please do not place profit over people.
Are there any specific tips that you would like to give to restaurant managers, supermarket owners, and also to food processing units on how they can ensure food safety as per their facility? To summarize it.
Begin with the facts. It's a trying time for us because in the age of easy access to information, there are tons of channels of misinformation. So having the objective approach to being able to tell the difference between what's objective, what's biased, what's unbiased, studying the data and being able to understand what the data really means can only begin from a place of sharing. So as a food business owner, as a food safety manager, as a food safety executive, if you are making decisions that is going to impact your team, your department, your business, I would strongly recommend that you begin to speak with other food safety leaders, not just within your region, but also across the world. It is more important, more so now than ever before, to have a transparent data exchange process, because what might be working for someone else may not work for us. And the only way we can find that out is if we openly exchange data, is if we openly exchange practices that are beginning to show positive effect. So I would begin with that. And as much as possible, use an objective approach when it comes to making decisions, because it's easy to get swayed by terminologies that you may not understand, or practices that don't seem to make a lot of sense. And if your gut feeling says that I need more time to analyze this, I need more time to understand what's happening, please take that time, because your decision is going to impact many other lives. So take the time to make those decisions, but also be in contact, communicate with other leaders, and try to address this as a community.
Okay, before I ask you the last question, I'd like to announce that we are now open for the Q&A session. If our listeners have any questions in mind, please feel free to raise them in your chat box, and I will bring them up in our discussion with Judy. So, Judy, tell us how teams can be trained to practice better hand hygiene in food handling facilities.
A creative approach to this would be, apart from your standard, how do you wash your hands, 20-second demos and tutorials, I think one way to approach this differently would be to ask, at what instances or opportunities are we not washing our hands? So I think trying to get your team to think about the flip side, where are opportunities where, I should have washed my hands, but I didn't. And you make a list of, instances where people should wash their hands but aren't, I think that's how you develop a culture of, hey, that's a good catch, and yeah, I should be aware of that. That would be a better and a relatable approach versus your standard, let's have a demonstration of how to wash your hands thoroughly, because again, knowledge by itself is not going to result in behavior change. They need to see examples, and that training needs to be relatable. So try to make it as relatable as you can and make it realistic to your business so that the employees there can see more examples of good hand hygiene at their place of work versus a generic video.
All right, thank you, Judy. It looks like we have a couple of questions from our listeners. So Satish Shetty, he
Sounds
asked,
good.
in dry places like food contact areas, how long will COVID virus survive?
Thanks for your question, Satish. And I would recommend looking into the nature of your packaging, because even within dry stores, you have multiple types of packaging material. You have metal, you have plastic, you have paper-based, you have cardboard-based, you even have biodegradable packaging. So there are scientific studies that are surfacing now. I wouldn't say it's at its point where it's validated. It's still relatively new. It's raw data. So some studies have indicated that the virus can, remain active on paper-based packaging for 3 hours. Some have even showed evidence of 72 hours. So I would recommend keeping a close eye on what the data says out there, but also being aware of what kind of packaging does your warehouse or dry store actually have before you start making those correlations.
All right, we have another question from Keith Watson. He says some countries are putting misting tunnels to supposedly disinfect customers and staff as they enter. How do you feel about this considering contact times?
Going back to the point of having an objective approach and a scientific approach, and I stress on scientific here, surface disinfectants do what the name says. They disinfect the surface. The virus, as we know it, requires a living host, and that host is us, humans. So yes, humans can go in and out of tunnels, and yes, they do have surface disinfectants on them, on their clothing, on their hair, on their skin, on their shoes. So on the surface, it may be working, and given how quickly they walk through those tunnels, some walk faster than others, I cannot say if the contact time that is required is being met. However, I would like to, for every one of us, to take a few steps back and think about what is it really doing? Because to make a claim that the tunnel is going to eliminate the virus is not a scientific claim, because the virus, if it's still in the host, it is still in the host. Surface disinfectants cannot penetrate the surface and eliminate the virus from the host. So that is a very important point that we need to take away from this.
All right. It looks like we've covered most of our questions. Judy, is there anything else you would want to cover before we wrap up? And this is also perhaps the last chance to send in your questions, dear listeners. So if you have any questions which you have not sent across as of now, please send them.
I guess I would like to take this opportunity to thank Clean Middle East for hosting this, and for your sponsor, Riza Hygiene, for making this happen. I think more conversations like this need to happen, not just amongst the scientific community, but amongst everyone else, because it's going to take a community to counter the effects of COVID-19. It's going to take a lot of learning And with that, some unlearning also, because we as a society are beginning to change, how we interact with each other, how we approach each other. So much so, I see videos out there of how to greet one another without physical contact. So if you really look at this from, a high level perspective, we are changing our ways of doing what we do every day. I encourage people to learn from their mistakes, and I strongly advise that you use a scientific lens to what's being said, what's being shared, and what's being done. Because if that objectivity is not included in how you understand the information or how you share the information, then it's going to be the spread of misinformation, and that's something we do not need in the climate of a pandemic.
Before we wrap up, we have one more question from Bhavna Fudani. Bhavna asks, is it necessary to disinfect plastic grocery bags in which food is delivered from supermarkets?
My counter question to that would be, what is the purpose of the bag after the food's been delivered? So, because once the food's been delivered, the bag has met its purpose. If you're going to repurpose the bag and you feel like, well, I'd like to use this bag for something else outside of a food facility, let's say this was, at home for domestic use, then I leave that to your discretion, but always follow, good safety protocols. We do have evidence that suggests that the virus can sustain itself on plastic surfaces for up to 3 to 4 hours. So I guess it all goes back to what are you using the bag for, and if you're going to use the same bag to, let's say, share food with your neighbor, then that's something you may want to think twice about. But if it's going straight to the bin, there's no need to disinfect it.
All right, it looks like we've covered all of our questions now. So thank you, Judy. We appreciate you being here and hope this brief session organized in association with Riza Hygiene helps our listeners gain perspective on the measures they need to take to ensure food safety during this pandemic. To all our listeners, thank you for joining us today, and we will see you next time. Thank you.
Thanks, everyone.